Wait, hold on. I think, Mildred, you forgot to introduce our guest today.
Oh gosh.
Yeah. Welcome to Season 2 of NUH's Care to Talk podcast. I'm Noah, the co-host.
And I'm Mildred, the other host. Last year, we had Season 1 of Care to Talk podcast where we talked about well-being in the workplace. And you can catch all of that on our YouTube and Spotify.
And this season, we'll be covering all the hottest topics in healthcare from head to toe. And today, we're starting with the head, mental health.
It's so early in the morning right now. And for those viewing this at home at your leisure time, good for you. But it's morning for us and I've drunk 2 cups of tea and I'm still sleepy. What about you guys?
Wait, hold on. I think, Mildred, you forgot to introduce our guest today.
Oh gosh.
Yeah. So, all right, we have Assistant Prof Cyrus Ho joining us from the National University Hospital. So, Prof, forgive our sleepiness.
Yes.
But please tell us a bit about yourself.
Okay, hi. Good morning, everyone. I'm Cyrus. I'm a senior consultant psychiatrist and assistant professor from the Department of Psychological Medicine. So it's great to see everyone. I'm great to be here. Yeah.
I think it's quite apt that Mildred here kind of forgot to introduce you despite drinking 2 cups of caffeine, because I think it's something that we kind of see a lot in the people in our 20s and 30s like herself and myself, that we are just a bit more exhausted despite what we do. We drink coffee but we come to our work still feeling exhausted, eye bags under the eye and all. So is that something that you notice as well?
So now that you mention it, I do see it quite often in my clinical practice. At the same time also in people around me. So many of them, they may have slept adequate number of hours, but they still feel tired the next day. So but I guess there's many reasons behind it, I guess.
Yeah. So actually, what is the change behind this? Like, what caused this? I mean, usually we think tiredness is something that maybe older folks might experience. Sorry for saying that, but I mean, people in their teens, 20s, 30s are feeling like, what's the change?
I guess for the younger adults now, they are also going through quite challenging periods with a lot of demands, be it psychological, emotional, or even cognitive demands, and they don't really have a good period whereby they can really rest. I mean, I'm sure all of you would have experienced, multiple, responsibilities or things around you that demands your attention.
Yep.
So sometimes it can be really quite overwhelming, and this adds on to the cognitive load.
Do you think that that's something that the youth need to take note of? That, if you're feeling stressed and burnt out, that's not a sign of weakness, that's just normal.
So I guess you're absolutely right? So stress is actually a normal reaction, a response to things around you. And everyone takes stress quite differently. So, and we should actually look at stress, confront stress, head on, and maybe be more aware and mindful of how it's doing to our body, our mind.
Could you share, like, maybe in terms of some of the patients that you see when they going back to burnout and being overwhelmed, could you share a typical scenario? I mean, no names and all that, but yeah.
Sure. I mean, stress is really something that's quite common. And of course, people who come to me, seeking help, definitely most of them, are going through stressful periods. And the way stress is being manifested really is quite different, from person to person. I have seen people coming in, having stress, but manifesting as problems with sleep. So they think that they're just having insomnia, a normal sleep problem. But after more interview, looking at the history, then we realize that actually that is something that's stressing the person up. So sleep is one. I also have people coming in with memory problems, telling me that they're very inattentive, they cannot focus, they cannot multitask as much as they are able to in the past. In fact, some of them were so worried that they have dementia, even though they're only 20s to 30s.
Wow.
Yeah, so this just shows how bad they feel their memory is.
Wow.
Then there's also people, right? Sometimes when they're so overwhelmed with stress, they start manifesting physical symptoms, right? Physical symptoms such as headache, giddiness, gastric problems, dryness, and then they just wonder what's happening to them. Is it something medical? And there's also people who go even more extreme ends of having dissociative episodes. Dissociative episodes are episodes whereby the brain or the body is so overwhelmed that the brain has to shut down temporarily. So this can manifest as derealization, whereby you feel that things around you are not real, or depersonalization, whereby you feel that you are not real. So out of body experiences. Yeah.
Am I right to say, like, if these certain symptoms combined, like for example, loss of sleep, loss of interest in hobbies, and they persist over time, then okay, those are warning signs. I should seek help.
Yes, definitely. Yeah,
see,
yeah.
yeah.
And if there's some form of impairment in terms of your function, be it in terms of your productivity, occupational, social relationships with people, then you should seek help, definitely.
Yeah.
Okay, I'm going to make you play fortune teller a little. All right. So if the current generation, as we are now, continues the way we are going, as you feeling stressed and all the time, not enough sleep. What happens when we hit our 40s, our 50s, our 60s? What are some of the issues that might crop up then?
If a person continues to experience stress, especially in the early stages of life, of course, it can lead to quite a lot of complications or comorbidities that's related to stress. So as I mentioned earlier on, if they don't sleep well, then it's unlikely that the sleep will improve, with time, right? So then sleep-related problems will start coming in. So for instance, problems with their mood, emotional states, and maybe even a lot of medical conditions can come in as well, right? Because sleep, unfortunately, is very much related to a lot of medical problems, and sleep is almost like the basic foundation to good health. So a lot of metabolic syndromes can come in, like hypertension, diabetes, high cholesterol. Yeah, all these are related to lifestyle. Yeah, and chronic stress.
You mentioned dementia also just now, right? Like people coming and being afraid that they have dementia even at a young age. But is that actual fear that people should have? Like if they're always stressed, and will they actually suffer from dementia when they grow older?
Unfortunately, right, stress in itself does increase the risk of many conditions. Because with prolonged stress, it increases the risk of inflammation, chronic inflammation, and inflammation is actually one of the pathological mechanisms to many conditions, and dementia included as well. Of course, I can't say that when a person is stressed, it's definite that this person will get dementia. But we do know that with stress, it can lead to depression, and depression increases the risk of dementia as well. So maybe through indirect mechanisms, it can potentially lead to cognitive impairment.
But yeah, what are some of the other physical symptoms? Like, will it affect your heart? Will it affect your metabolic rate?
The other parts of the body, right?
Yeah, will you start to stress eat and binge and
Yeah, definitely. So I mean, with chronic stress, it does lead to a lot of dysregulation in the different parts of the body. So with stress, it can actually affect certain parts of the body known as the hypothalamic pituitary adrenal axis, or what we call as the HPA axis. And when this happens, there is actually a dysregulation of the cortisol released. And we know that cortisol is actually a stress hormone.
Yes. Yeah.
Right. At the same time, it can also lead to increased production of all these pro-inflammatory cytokines, and these are actually things in the body that increases inflammation. And with that, it can increase the risk of arteriosclerosis, affect your vascular function, so increasing the risk of arrhythmias. So certainly you can see that it can lead to heart problems. And then because when there is chronic inflammation throughout your body, then of course it can lead to a lot of issues in terms of, for instance, insulin sensitivity, leading to more insulin resistance, of course leading to increased risk of diabetes.
Yeah.
So you can see metabolic syndrome will probably increased. And of course, this is what happens physiological inside the body, but externally, when a person is stressed up, as you rightfully mentioned, a person tries to cope with it. Sometimes we cope using good means, sometimes we cope with maladaptive means.
Yep.
And binge eating is definitely one. I mean, I myself, sometimes I cope by eating, right, which is really bad.
Yep.
And of course, we go for our comfort food, right?
Yes.
And what are some of the usual typical comfort food, like fried food, sugary food, and all this actually increases inflammation, unfortunately, as well.
How would you support? Like, let's say, Cyrus, right now you and I are having coffee, and I come to Cyrus, I'm very stressed. My boss not treating me well, my wife, children giving me a lot of problems. Very stressed. How would you help him?
Yeah. I guess the important thing is that you do need to talk. Talk to you, to really understand what's really happening. Provide that listening ear, and of course, try not to be judgmental, right? Of course, listen to the person's perspective, provide that space, and then perhaps going through with the person about what's important to him, right? And then maybe sometimes moderating expectations to see whether there's any ways that we can maneuver around that situation. Because sometimes the person can feel really stuck in a stressful situation because he can't see what's really happening. So as a friend, you can see from a helicopter's view to see what could be other possible solutions. Then helping the person to perhaps make some adjustments. Like for example, if the person is really stressed with work, then should the person actually go to speak to the boss to try to negotiate to maybe reduce workload, or maybe try to see how he can shift to some other task that's maybe a bit easier in the meanwhile, right? And then of course come up with resolutions, I think, importantly. But if a person is really quite stressed up, then something really needs to be done rather than just continue and persist on.
What if the person is just really stuck in that situation? Maybe you're like, okay, I'm in this work situation, it's gonna stay for at least a couple of years, or maybe I don't see an end in sight. What is one thing they can change at least?
So if the environment is difficult to be changed, then the person needs to change himself. Right? So internally. So how the person copes with stress, becomes important. So perhaps, seeking support from friends, from colleagues, and perhaps lowering the priority of work in the person's life and focusing more on personal life, on family. So doing things that he or she likes, to get validation, to feel good about oneself. And then, of course, like exercising, spending more time with family, all these things that helps the person to feel better and maybe reduce stress.
What are some avenues, professional avenues that people can go and seek help?
In terms of seeking help, of course, you should try to seek help from within your family, your loved ones, your friends, as a start. But if you find that, you need more professional help, then of course, you can seek support, from counseling services, be it in a community, right? Like Family Service Center. And nowadays, there's also hotline, the Mind Line from IMH, which is a national helpline, the SOS helpline as well. And there's also a lot of services out there now, that actually do online counseling or even therapy work, if you choose to do online. And then, of course, there's physical services as well. And if things are really quite bad, then, of course, you should seek help, perhaps from a mental health professional like a psychiatrist.
If listeners can remember only one thing from this conversation, what should it be?
I think stress, is something that everyone will go through in life. So it's unavoidable and we do need to face it. But how we face it, and who we can turn to for support, that's the crux of it, So I don't think that we should be alone, in our journey, right? So we should always seek help, get the support that we need, Yeah, I think that's important.
We've come to the end of our podcast. Thanks, Cyrus, for joining us today. Remember to like, share, and subscribe, and catch the next episode of the NUHS Care to Talk podcast here on Spotify and YouTube.
See ya.